Hi and welcome to the Barney Chronicles. In this video I wanted to talk about my roller coaster ride with my dodgy organs. The reason I've waited to post this video is I wanted to make sure I've got all the information, had all the tests, got all the results, so I'm going to go through pretty much everything, how it started, the conclusion and all in between. The reason for posting this is really to highlight the importance of getting blood tests done, starting any medication, regardless of its GLP-1s or anything else, or even just when you're getting older. I think it's crucially important. I'm ultimately one of those people that hates going to the doctors for anything really. It has to get pretty bad before I will do. But I'm very lucky that I did, and I'll get onto that in a minute. If you are new here, my name's Scott, I'm 38 years old. I started taking Mounjaro in April, so 6 months ago now. Managed to get down to goal weight, now on maintenance, in a good spot, but it's been, like I said before, a bit of a roller coaster. And if you are new here, again, look, thank you for checking out the channel. I really appreciate it. Please, hit the subscribe button, the like bell, I think the hype button now. I feel incredibly old saying that, but yeah, if you do, everything helps the channel, of course. But yeah, I'm going to go through what's gone on, where I'm up to now, what's next. But yeah, let's get into it. So from the start, I started taking Mounjaro on the 6th of April. I ended up going to the doctors for shoulder back pain I've been having. I had a car crash a couple of years ago, and it kind of flared up a bit, so I went to the doctors just to realistically get referred for some physio or something, just to alleviate that. I sit in an office chair most days, so it's just for that basically. When I got there, the GP, I spoke to her about taking Mounjaro, what I'm doing, lifestyle, all that kind of side of things. Straight away, she recommended, she pretty much told me that we needed to do routine bloods just to make sure everything's in order, bit of an MOT, fantastic. So, had the blood test done, and it was quite scary results. I mean, I put a link, for some of the videos you want to see them, but there's lots of abnormals, so there's a big, huge list of abnormal bone serum, abnormal kidney function, liver function. Pretty much all of it was abnormal, to be completely honest, which was, as you can imagine, quite scary. So I had a phone call booked in with a health lady, not a GP, but anyway, on the phone call it was pretty useless, to be honest. It was just about that some of my cholesterol was slightly higher and more lifestyle changes that needed to be done on my end to reduce that. As you can imagine, my questions were more about the scarier stuff, bone serum, kidney, etc, etc. And like most people, I immediately went to Google, started Googling the results, and going into a bit of a rabbit hole of what's going on and all the rest of it. So ended up having a meeting with the GP that said they wanted to do more blood tests to double check things, but things didn't look too bad. Had more blood tests done, things were getting slightly better, and ended up saying, look, the kidneys are fine. I've actually got the kidneys of a 21-year-old or something along the lines of that. But they were not concerned, but they wanted to do more tests on my liver. So had more blood tests done. And then got referred to ultrasound. So an ultrasound test done on my liver, pancreas, all the organs, what have you. And again, another the results came through on my NHS app, which is the health service in the UK. Again, pretty scary reading. It said that the liver had a coarse appearance. There were 3 echocentric areas on the liver, or like lumps on the liver. There was a septated cyst on the left kidney, which is like a worse kind of cyst, which can be bad. But yeah, the actual results that came back, phenomenally scary. Like, it was a case of the 3 lumps or the echocentric areas, whatever it is, they couldn't rule out, something more sinister, cancer, etc. And so after the ultrasound, I had another meeting with the GP. I think she tried to put my mind at rest, but again, by Googling all the things that came back on the results, pretty heavy stuff. So I was booked in for an MRI, like a die cast MRI, where they put a dye into your blood and then they MRI your liver, etc. The reason this was really scary is because after Googling the results, it could be something pretty bad. And my mum unfortunately passed away a good couple of years ago now from liver cancer. So the MRI was booked in for, I think it's 3 weeks to a month after the ultrasound. So I had a month's worth of just waiting and being pretty petrified. At that time, my partner was heavily pregnant, so bringing a child into the world and not knowing if you're going to be there to see them grow up, as you can imagine, petrifying. And because problems with liver are asymptomatic, you don't really get symptoms until it's bad. Of course, spiraled, massively spiraled. I have been at the time I was having quite a bit of discomfort as well, where your liver is, and so I thought, this is not good, obviously. And I believe best case prognosis for the worst would be 1 to 5 years. So lots of sleepless nights, lots of worrying about what's going to happen. The MRI tied in perfectly with the birth of my son. So I was actually in the hospital with my partner while she's in labour, having to then go to another area in the same hospital to get the MRI done. And then even when that was done, it was another month before getting the results. So lots of time for spiralling and worrying, obviously. And again, this is why it's so important, I think, to get blood tests done and things, because if I hadn't done it, it could have got a lot worse and probably quite quickly. Now, I'm not putting this down to Mounjaro. I think it's probably more before Mounjaro. I was a heavy drinker, and so this is probably damage that was done before starting this. And if anything, starting Mounjaro's been the best thing I've done, because it's made me eat healthier, made me stop drinking, put me in a much better position to recover, get better, So yeah, got to results for the MRI, and the echocentric areas are benign, which is obviously brilliant news. The cyst on the kidney wasn't a septated cyst, just a simple cyst, again, quite common apparently. But yeah, been referred to a liver specialist just to double check things. I've got a couple more blood tests, etc. But yeah, I think keeping on top of things like this and getting regular blood tests are hugely important. That's really why I wanted to make this video. I wanted to, anybody else who's out there, who's on this journey, who's thinking about doing it, either having baseline bloods done at the very start before taking it, or having periodic tests anyway, just to keep on top of your health and making sure everything's the way it needs to be. I think it's hugely important. If one person goes and gets their bloods done from watching this video, it's a massive win for me. So all in all, it's positive news. From thinking I'm dying to maybe things are okay. Of course, it's brilliant. There are still a couple more tests to be done, but I think it's a lot better than I thought it was going to be. So updating where I'm up to. It's been a month since I last posted. Apologies, I've gone a bit AWOL. But I wanted to realistically put this video out once I had as much information as possible. Also, becoming a new dad, I rarely get half an hour for a nap, let alone making a video, editing it and putting it out. So apologies, but thank you for bearing with me. Still trying to grow this channel. I'm going to be doing updates as often as I possibly can do. And where I'm up to at the moment, still doing the split dose, so 1 injection every 3.5 days rather than weekly. I have stuck with using my quick pen just as a vial now, so I'm not using the little attachment needles that come with it, but the 1 unit insulin syringes. Because my pens are lasting longer, it's just an extra layer of safety for me that the medication inside the pen is staying as sterile as possible. I did reduce it down to around 1.5 milligrams every 3.5 days, but then gone back up now to 2 milligrams. I did notice that I wasn't getting the same effect. Again, look, I've always said I want to use willpower here as well, so it's not about completely getting rid of my appetite, but the 1.5 was a little bit too low. So back up to 2 milligrams every 3.5 days, and then going to start to slowly now taper that back. Been getting in the gym more, which is good. After having the child, being able to get back into the gym's been massive for my mental health as well. So this week I managed to get in 3 times. I'm going to try now and kind of increase that. I've also got baby Barney his first swimming lesson tomorrow, so well excited about that too. Not sure anyone's interested about that, but I thought I'd drop that in anyway. So yeah, I'm going to keep doing updates as and when I can. If there's anything you want to see, any certain content or anything you want me to kind of do videos on, just leave a comment below. I'm more than happy to kind of make any content that people want to see. It's you guys that have realistically grown this channel, so yeah. But I think that's it for this video. Bit of a short one, but I thought I'd give an update on the whole liver thing. And again, like I said, it's really important, I think, for the blood testing to people to get checked out, man. I think it's really important. So yeah. Thank you for sticking around if you've watched the whole video. There will be another video out next weekend. And yeah, I'll see you on the next one.